Hello, good afternoon. Thank you for joining us today for this press conference on the report of the Special Rapporteur on the Right to Health that you will present this afternoon to the Human Rights Council. Please note that this press conference is under embargo until the presentation at the Council has taken place this afternoon. We will start with a few opening remarks from the Special Rapporteur on the Right to Health, followed by questions from journalists online. Dr. Tlaleng, you have the floor.
The growth of technological innovation is rapidly defining and reshaping the right to the highest attainable standard of physical and mental health. In a growing number of countries, it has strengthened the ability of governments to respect, protect, and fulfill this fundamental right by ensuring that all health facilities, goods, and services are available, accessible, acceptable, and of good quality. New technologies can foster great inclusion and participation and compensate for weaknesses in existing health systems. They also offer opportunities to improve access to underlying determinants of health, including producing new economic opportunities and rapidly increasing the growth of global circulation of health-related information. The Secretary General has recognized that new technologies, including digital technologies, can advance universal health coverage and thus play an important role in the realization of the right of health of everyone. Respect for human rights, including economic, social, cultural, civil, and political rights, has proven yet again to be fundamental to the success of public health responses and recovery, as shown by the recent pandemic, COVID-19. And therefore, to help member states in their response, I have decided to focus my report this year to the Human Rights Council 53rd session on digital innovation and technologies and the right to health. And in this report, I analyze the impact of digital innovation and technologies on the right to health, including its availability, accessibility, acceptability, and quality of facilities, goods, and services. I have focused on digital innovation and technologies and the right to sexual and reproductive health, as well as on the impact of these digital technologies on privacy and the use of data. Of course, I raised some concerns that the inequalities we face in real life, offline, can be replicated and often sometimes compounded online spaces through digital apps. And I remind states as well that they have to promote digital inclusion and access to affordable and reliable connectivity and the underlying need to address digital literacy and the gender digital divide. I also seek to clarify to member states their legal obligations that arise to the right to health framework from a non-discrimination and equality perspective, and in recording that these rights must be protected offline as well as online with the use of digital tools and in online spaces. It's important as well to remind states as well as private actors, including technological companies, their obligation in this context of rapid growth of technologies and innovation as it relates to the right to health, all of the human rights that need to be protected. I also focused on good practices, including recommendations that are key to implementation and the operationalization of the right to health in the context of digital health and governance and participation. Thank you.
Thank you very much for these remarks. We will now open the floor to questions. If you're online, please raise your hand and we will give you the floor. Dr. Mofokeng, would you like to tell us a little bit more about the report?
So the report was written in consultation with civil society organizations and rights holders. This is an important part of the methodology of the report, to get the first-hand analysis and experiences of rights holders on the ground, to understand firstly the kind of challenges that they are currently experiencing with the use of digital technologies and innovation in health, but also what they anticipate as some of the future challenges in how they experience digital innovation in health. This is important, as we know, in the different regions of the world, there has been some attempts by governments and regional bodies to provide some technological guidance in terms of privacy, in terms of data use and data protection. But we know that in many areas, enforcement is lagging behind. And so with the rapid growth of digital tools and technologies, it was important to really understand firsthand what are some of the challenges that rights holders anticipate to be facing in the future. This is really important because when one comes up with recommendations to member states and multi-stakeholders, it's important to make sure that those can be operationalized, but ultimately they protect human rights. And the only way to protect human rights is to listen to people who are often invisible, whose voices are not always heard, and definitely do not have a seat at the table. So the report is designed in one way to really elevate the voices and amplify the voices of people who are, in any other sense, marginalized in communities. These are LGBTAQ+ populations, these are migrant populations, these are women, also children, and concerns of older women, for example, in how, in one sense, technology enables them to access information in safer spaces, but on the one hand, they do experience targeted harassment online because they are women or because of their sexual orientation or gender identity. Some of the key principles that will come through in the report speak about, the need for non-discrimination, for equality, for meaningful consequential participation, but also for transparency, because this allows for accountability, and that rights holders, when things go wrong, there can be recourse. And of course, overall for member states, the recommendations look at how they can use their existing international human rights laws and standards and the guidance provided under the Right to Health framework in making sure that whatever they do not lead to divestment in primary health or public health, that they use and see digital innovation as something that enhances what's already there.
Thank you very much. Are there any questions from the floor? We have a question in the chat, so I'll read it out. It's from Efe, Juan Verano from the Spanish news agency. He's asking if artificial intelligence is among the future challenges facing healthcare in the world, how this technological advance could affect the groups you mentioned and how these issues could be solved.
Artificial intelligence is indeed a current, but also a future concern when it comes to healthcare. And it's important in the report, as I recall, to member states that they need to ensure that rights holders have access to information, but they actually fund and support and resource efforts to actually increase digital literacy so that rights holders actually know what concepts such as artificial intelligence mean, but also they understand what their human rights are in that context. It's also important to remember that people who are already experiencing discrimination sometimes also experience discrimination based on language barriers. People have disabilities, they have visual or audiovisual challenges, and therefore, as we think about rapid growth of artificial intelligence and digital tools in healthcare, we also have to think about the people who we will be, again, at risk of leaving behind with these kinds of advancements unless we pay specific attention to that. I think it's important when you think about artificial intelligence to also think about who are the people behind the code, for example. A lot of feminists and people who are orientated around digital justice often talk about the concept that, you know, racism and sexism, for example, and ableism and the kinds of homophobia and transphobia that we see in real life has a real risk of being embedded in coding unless we are, again, aware of who the coders are, that they themselves are human rights orientated and subscribe to the issues of non-discrimination and understand equality, because we also run a risk of having healthcare tools that are meant to, on the one hand, solve real challenges in healthcare, but they may, in the way that they are designed, in the way that they were set up and coded, actually further lead to marginalization. So it is important that rights holders firstly understand, and this is important in terms of digital literacy. It's also important to also talk about the gender digital divide. A lot of the discrimination is still very much gendered. And so when we talk about access to healthcare, artificial intelligence, how many women are participating and making decisions in healthcare, especially around digital tools? Those are very important. And that's what meaningful consequential participation is about. It's that when people come to the table, that what they bring to the table is actually heard and taken up. And that's one way to reduce inequality.
Thank you very much for this answer. Do we have any other questions? Please raise your hand or leave the question in the chat. If there are no further questions, we will close this press conference. Thank you very much, Dr. Mofokeng, and thank you for joining us online. Have a nice afternoon. Thank you.